the Cyrillic alphabet in Serbian. I went to college in Youngstown State University in Ohio. When I was 21 years old, I then moved to Loma Linda, California, where I did medical school. I graduated med school in 2016. I did my medicine internship there as well. So I spent 5 years in California, and then I moved to Norfolk, Virginia, where I'm currently a chief resident doing my dermatology residency. So I definitely get this question a lot. What are my interests outside of medicine? All right, so number one, I am a huge sports fan. So when I was younger, as a freshman in high school, I actually made the varsity basketball team. I was very into playing basketball. I basically slept, dreamt, ate. I mean, if I wasn't in school, I was playing basketball. So I basically follow the NBA. I used to really follow it. I had and have season tickets for the Cleveland Cavaliers. I have LeBron James's headband and autograph. So you can say I am a crazy NBA basketball fan. But I really do love tennis as well. Shout out to Novak Djokovic, Serbian, my man. So yeah, I really, really love sports. I like to play them. I like to be active outdoors. So that's one of my number one passions and interest or hobby outside of medicine. We're asked, and I know this is a great reminder that I need to actually practice flute again since it's been a while, but I also sing in group choirs as well. So another hobby is going on mission trips. So my husband is actually a board certified pediatrician, internal medicine doctor, and a dermatologist. And he loves going on mission trips. So once I'm done with my residency, of course, I would love to go more often with him. But we have been on a mission trip together in Guam, and we absolutely loved it. So we love providing care to those that need it, especially in the field of dermatology across seas. Also, I have built a community of healthcare millennials all about living their best life. So passionate about health, multiple streams of income, entrepreneurship. So more on that in 2020 if you want to get involved. And I'm so excited to release more info on that. But that is definitely another hobby, actually passion of mine. And then in 2020, I will have consistent articles on my blog about skincare, beauty foods, which I absolutely love, nutrition, lifestyle, and also being a mama in medicine. So all that stuff will be on my blog in 2020. So make sure you check out my website, drnikoleta.com, as there will be many new updates coming up in the next few months. And finally, the last interest outside of medicine is basically every month I read a personal development book. And right now it's usually on Audible, but it's the way that I grow my mind. And also I learn more about business, successful people. And so I really listen to this stuff probably 15 to 30 minutes every day. I usually finish one personal development or book outside of medicine per month. So that is something huge, something that again, guys, my profession, so I graduated with my Doctor of Medicine degree, MD, and my specialty is dermatology. And I will also be doing a fellowship in dermatopathology next year. So I became a Nikoleta ambassador because confidence is so important at work, and how you dress is so important not only for patients, but how others view you at work. And just like my brand and my mission for Dr. Nikoleta is step out with confidence, I am all about that. So Nikoleta aligns with my mission. Hey guys, it's still dark outside. I just finished a 6 a.m. 1 hour HIIT training class, so stay tuned. My morning routine: first I wash my face with the foaming facial cleanser by Elta. Then I use a vitamin C serum on my face, and then finally I top it off with tinted sunscreen. Hey guys, now we're going to show you all about DermPath. Now, DermPath is something that all dermatology residents have to take every single year of their 3 years of residency, and it is on our dermatology board certification exams. Now, I will also be doing a 1-year DermPath fellowship, after I finished my derm residency. Now, most residencies have a section where there is a scope, and all the residents sit around with the dermatopathology attending. So this is ours, and this is my seat. So as you see, this is where we sit, and we do this 2 to 3 times a week. And so we have a TV up there, and so the TV projects what we're looking at. So if we have rotating medical students or anyone else interested in looking at what the residents are looking at the scope, then they're able to see it. So that's really awesome. And so we always, when we're doing DermPath, we always have a book open next to us. This one is actually Elston, which is our, DermPath Bible that we use as residents. So we always have that open next to us. And this is where we are at the head of the scope, and this is where I'll be on my DermPath fellowship. So what's really awesome is we actually have a lot of teaching DermPath slide sets. So they're actually like right here, so we have a lot of different ones to review for board's purposes. I'm going to show you all where the residents do our didactics, the conference room. So every Monday and Friday for about 4 hours in the afternoon, we do our resident didactics, and those consist of dermatopathology, all of dermatology, gender, pediatric dermatology, surgical dermatology, and basically everything that we need to know for. So this right here is our beautiful, awesome lecture room where we have our lectures every Monday and Friday. So as you see here, we have a whiteboard that we use to help, explain things, and mnemonics, help us remember things in derm. And here's our bookshelf that has all our textbooks from, years past, old textbooks, anything that we can use to learn and study. So we have 8 residents in our program, and this is kind of where we all sit around. Again, we spend a majority of our learning right here in this room, and it's super important that dermatology residents stay on top of everything that they have to read, because by the time you get to 3rd year, it's a lot, and boards are just around the corner. So again, this is the awesome. I'm going to take you guys to the resident room. So the resident room is just around the corner here. With the resident room, it's one large room. It doesn't always stay super clean, but this is my desk here. And so I have my own computer, I have my own work area, I have my locked cabinet here that I keep some books. We have like more areas, we have scopes, and so all the residents have a seat in a section in this room, and most programs do have these resident rooms where it's just one room where all residents are there to talk to each other, help each other out, talk about consults, talk about ways to study better, and it's the resident room, and that's what this is. And here we have the front to our clinics, and there's me right there. So this is where the patients check in. I'm going to take you to behind the scenes. This right here is what we call our workstation. So we have 3 computers here for our clinics, and we have a whiteboard here if we need to explain something when we're working with the attendings. And down the hall here, we have a bunch of rooms for our clinic. So plenty of patients to see and plenty of room to see our patients. And just down the hall on this side, there's a bit more rooms here, as well as down the hall there. So we have 2 halls, a lot of room to see a bunch of patients. Here we have our workstation. We actually have a lot of reference books that we keep right here. So if we open up here, anyone that's rotating, we can look at all these books. We have general books that medical students can use, and then of course the Bologna, which is the textbook that we use. As typically how a clinic room is set up, we have a computer, we have the patient exam chair, and then this is where we do our biopsies. And I just wanted to review a few things with you all about the most common biopsies that we do. Okay, so I'm going to go over the shave biopsy. Now, the shave biopsy, we use it in dermatology when we know that the pathology for the lesion that we're biopsying is, pretty superficial. So we see the epidermis, the dermis. So when we know that that's what we're looking for, that's why we do a shave biopsy. There's all sorts of other reasons why we do shave biopsies in dermatology. But what it is basically you have this dermablade, and it's just this little razor blade that you use for the actual biopsy part. And so we numb up the area, and then after that, of course, you use a shave biopsy to take it off. And then what we do to stop the bleeding is we actually use dry sol. If it's bleeding too much, we might use cautery, but usually we use dry sol. And then we put the specimen in a formalin jar for doing H&E staining. And here are the other materials that we'll need. Another very common procedure that we do in derm is a punch biopsy. Now, typically we do this in the hospital setting, or we also do it in clinic when we want to go deeper into the dermis and possibly also get some of the fat, or it just depends on what we're looking for. So again, it always depends on what are we thinking clinically. Is the pathology deeper in the skin? So for different reasons, sometimes for cosmetic reasons, if we want to put sutures in for it to heal nicer than a shave biopsy. So there's many reasons why we use a punch biopsy, but the only difference is when you do a punch biopsy, you take the specimen out, you put it in the formalin jar, then you're going to actually either use a suture to close it, or you could use something called gel foam that actually absorbs and dissolves within the skin. Either way, both of them will stop the bleeding, which is our end result. I'm gonna go over some of these samples that we carry. So especially in the wintertime, I love these. So these are little baby Vaseline bottles that if you're on Accutane or oral isotretinoin for acne, these are great, but just in general, I use these on the lips. Basically, they're excellent for wintertime. Vanicream is another product where we love giving it to patients with eczema because it's hypoallergenic, free of dyes, fragrances, and any other problem allergens. And so they have gentle body washes. All right, guys, so quick lunch break. I'll be right back. I will leave some stories here for you to ask your questions, and I will be right back. So now that you know how my Botox was done, I'm going to share my passion project. So it is to inspire healthcare millennials to live their best life in health, business, as well as just their lifestyle and medicine. And it is hosted on the Millennial Doc podcast, and it is available on Stitcher, iTunes, and Spotify, so you could find it on basically any platform. All right, everyone, I am home from work and spending some little quality baby time. But if you guys have any questions about podcasting, about dermatology, about medical school, hi David, feel free to make sure you DM me or you can email me. Again, I'm doing that giveaway today. First 30 that leave a 5-star review and comment on the podcast, make sure you follow the instructions. But learned that David is a slobberfest right now, right, David? Right? You don't like the camera, do you, huh? You don't like the camera, huh? To go to work real quick. I'm collecting some data for research, so I put the baby down and then I went to do this for an hour and I'm going back home now. All right, I'm home now. Hey, Hub. So, hey. What's your favorite part of the Nikoleta jackets?
I like how they fit. I think they're very stylish. They're also, and probably the best part is they stay clean for a long time. They stay white.
Awesome. Have you ever tried to spill coffee on it?
No.
No? Okay. All right, guys, that's all the time I have for the takeover. I hope you enjoyed it. I hope you had a lot of fun. I'm just going to finish off here with my nighttime routine. And thanks so much. God bless. And if you have any questions, feel free to ask.